The relationship between mental health and physical health, presented by Mike Allen with Therapeutic Connections. So the objective of this presentation, it will help the participants to better understand the link between mind, behavior, and body. And also understanding this link is an important step in identifying strategies to help agricultural workers who are living with chronic physical conditions and who also present with mental health conditions such as depression and anxiety. And not only agricultural workers, but therapists, teachers, police officers. This is pretty much applicable to anyone. So mental health and physical health have a bi-direction and complex relationship. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. There is no health without mental health. The association between mental health and physical health. Poor mental health is a risk factor for chronic physical conditions. People with serious mental health conditions are at high risk of experiencing a chronic physical condition. People with chronic physical conditions are at risk of developing poor mental health. Chronic medical conditions are associated with mental health conditions, and you can see the list here. Diabetes, people who are diabetic typically have major depressive disorder, 2 times the greater, and pandemic disorder, generalized anxiety, and post-traumatic stress disorder. Arthritis, you can see the connection here with mood disorders and anxiety, health diseases, anxiety, depression, phobia, panic disorders, obesity, clinical depression, eating disorder, gastrointestinal anxiety and depression, cancer, bipolar disorder, schizophrenia, and asthma is associated with anxiety and depression. No health without mental health. Are you depressed because you have diabetes, or diabetes causing your depression? Well, yes. Stress about medical symptoms. We all have stress when we hear about a medical symptom that we may or may not be diagnosed with, but just the mere thought of having a medical issue can bring on stress. Medical conditions can lead to the pressure and changes of lifestyle that patient find unpleasant. Unplanned and unwanted lifestyle changes can lead to stress. A patient feels worse than anticipated, resulting in acute stress that interferes with physical recovery. No health without mental health. Again, this is just a correlation and an illustration of showing how diabetes and depression are connected to one another. The premise: stress operates by altering the magnitude of the airway inflammatory response that irritants, allergens, and infections bring about in a person with asthma. So somebody who has asthma, if you have a child with asthma, this display shows how the asthma, or just the anticipation of having an asthma attack combined with the allergens and environmental infections can cause a stressful lifestyle. Psychosocial factors in asthma. Unexpected nature of asthma attacks can generate that anxiety and fear and uncertainty of that illness, risk of learned helplessness and depression, emotional reactions. Anxiety play a role in overutilization of services in asthma treatment. And some recommendations: improve access to screening and prevention services, assessing emotional and cognitive factors relevant to diabetes and the diabetes distress scale, and some recommendations: having some targeted interventions, lifestyle changes, promoting healthy lifestyle, smoking cessation for those target interventions, psychosocial interventions, identifying some social supports, psychoeducational components in education on like debt and finance advice, integrated care, integrated program with your primary care physician, with mental health workers, depression and case managers. Social, identifying and partnering with social organizations to support the patient is also helpful as well. So as always, I hope that this presentation was helpful with allowing you to learn more about the relationship and connectedness of mental health and your overall health as well.